Hello to everyone, dear. So, in today's session, I have brought a topic which is known as a partograph. So, when you're studying OBGYN and you are there in the final year and all, so it's very important to learn how to chart a partograph. So, let's start the session. So, like myself, I'm Smita Singh, and I have done my graduation plus post graduation from nursing from AIMS, dear, and my specialty of obstetrical and gynecology. Welcome to my channel, dear. So, if we talk about this partograph, dear, it is a combination graphical representation. Okay, so it has a combination of some charts in which you will gonna see some detailing. Okay, so if it just have a discussion from the starting how you will gonna read this chart in the uppermost foremost, whatever the things you can see on the screen is all related to the patient identification data. Okay, so patient name, gravida and parity, everything is written on the foremost area and all. Okay, and the gravida, parity plus about the membranes also. For example, if a patient membrane, that is amniotic membrane, has ruptured prior when she came to the labor room and all, we have to chart. We have to ask the patient, okay, when you felt the leaking, the patient will gonna tell you, okay, I started having leaking 2 days back or 3 days back. Okay, so here you have to chart whether the membranes were intact or ruptured at the time of admission. Now, if it's see to this chart, we are having various sections are there. The firstmost section which you can see is this section is about the fetal heart rate monitoring. A normal fetal heart rate monitoring varies from 120 to 160 beats per minute here. 120 to 160 beats per minute and all. So all the chartings has to be done about the fetal monitoring, okay, every half an hour. So how you will gonna check in the clinical area about the FHR with the help of Doppler. So we are having a Doppler and we are having a stethoscope also. So according to your convenience and the time, you can check. So the this has to be done with the point. You have to put a dot. Okay, you have to put a dot whenever you're gonna check, and then you have to in the final you have to join all those dot accordingly to represent your paragraph. The next section, the below this section, you can see some two boxes are there. Each boxes I will be explaining in the further section also. So this is just an overview. So in this section, it tells about this about the fetal membrane. So whether the membranes are contact or ruptured, and if it is contact, is well and good. If it is ruptured, then you have to explain about the color. So what kind of color you can see the amniotic fluid, whether it was a clear or it was a meconium stain. If it was a clear, then you have to write C. If it was meconium stain, you have to represent it with the M. And if it was bloody in nature, blood color, then you have to write it B and all. Okay. So again, dear, here we are having one more column which is represent about the molding. Okay, tells you about the sorry, it tells you about the molding kitna molding hua hai. Okay, so molding kitna hua hai, whether it is +1 overlapping kind of or +2. So how you gonna check the molding? It is done with the PV. Okay, we will gonna do per vaginal examination and we're gonna see whether how much molding is there. Okay, next the session, the column which you can see is about the cervical dilatation. Again, I'm telling you in the next few minutes, I will explain each and every box how to represent. It's just an overview here. So in this section, it tells you about the cervical dilation. Okay, cervical dilation, which was done by doing PV. PV करने से हमें पता चल जाता है whether the cervical dilatation is 4 centimeter or more than that accordingly. And again, this section here also there is one more thing which tells you about the fetal head descent. Head descent, how much fetal head descent down into the pelvic brim and all, it is decided. Okay, so okay, next. Okay, the next column which you can see uh that about there are two boxes are there. Okay, two boxes are there. So here it's written about the time. So at which time the patient PV is done and all those timing at the time of admission, you have to chart. The one more important thing here, I want to include that you have to start using Partograph when the patient centimeter PV per vaginal examination is 4 NO. Before that, Partograph charting is not done. Okay. In today's scenario, we are having a modified Partograph. Okay. In that, we are starting from 5 centimeter. But for your knowledge, since we are using, I'm teaching you old Partograph, the charting is to be done with the 4 centimeter. Okay. Before that, for example, if I ask you, a patient comes to the labor room with 3 centimeter, whether you're gonna do a Partograph or not, then the answer is no, you will not gonna do Partograph. So let's move further. So here you have to write timing, whether it was 5 a.m., 6 a.m., and everything like that accordingly. Now this column downward over here is represents about the contractions. So you need to check the contraction of the patient, how much contraction the patient is getting. Okay, whether it is a mild, moderate, or severe kind of contraction, you have to shade accordingly. Okay, so again, I will tell you in the further session. And now this column, which is in this area here, this tells you about the medication. If you have given any kind of medication or patient has received any kind of medication, you have to chart here. Even in spite the patient is getting a oxytocin drip over here, you have to write as 1 pint NS with oxytocin like that. Okay, with oxytocin, how much international unit? For example, a patient is getting 1 pint NS with a 5 international unit at the drops of 4 drops per minute. Okay, according to the doctor's prescription, you need to do the charting. Okay. Now, there can be a case, also, dear. There can be a case that patient is coming with you with the rupture of membrane and it is too long. So sometimes we need to give antibiotics in between that. So that antibiotics, for example, ceftriaxone, okay, ceftriaxone, dear. So it has to be charted over here. For example, we do not give antibiotic to every patient who is coming and having labor pain. We are giving to the selected patient who are having a chance of having infection. For example, there's if your membranes are ruptured, patient have an increased chance of having chorioamnitis, ascending infection. So to prevent from that, we need to give some antibiotics during labor and all. Okay. Next, move to the further sessions and all. Next chart, which you can see on the screen, dear, this is all related to the mother parameter. It's all related to mother parameter, mother BP, pulse, and everything is charted over here. And then this last column is about the mother's temperature, and that this again, these 3 columns represent about the urine output, or you can say protein test. Okay, so we need to rule out whether the mother is having any kind of proteinuria. If there is a proteinuria, that means mother might be having a chance of having preeclampsia or gestational hypertension during pregnancy, and so it's very important. Again, the urine output is also important because you all know what is the normal urine output. The normal urine output in 1 hour is 30 ml per hour. If it is less than that, it indicates that it's oliguria. So it's very important to do the charting of the mother, okay, whether she is having oliguria or if there's a decrease in urine output, any kind of kidney dysfunction is there or not, we need to rule out there. So this was about the overview. So let's move further. Okay. Till now, okay. Now, see, this is a image of some student, of roughly student has done the charting, which is not at all proper, or you can say not correct exactly, but just have a look on the screen there. You have a look. Okay. So one thing, let's start the discussion. Whenever you're doing charting for the first time and the patient is more than 4 centimeter and all, the first charting has to be done on alert line. The first charting has to be done on alert line, dear. Whether it is 4 centimeter or 5 centimeter or 6 centimeter, the first charting, okay, has to be started from the alert line. And after that, after the 4 hours, the second charting, and that if it is again anywhere else, we can go for anything. So this in the image you can see dot, and then you have to represent with X. Similarly, for example, patient is Patient came at 5 p.m. over here. So our 4 hours the charting was done. 4, 5, 6, 7, 8, 9. So 9 p.m. PV was done. For example, you will write over here 9 p.m. PV was done. So just see, 5 is over here. This is representing the half hour. For example, just have we can write over here key patient was like a 6 centimeter. So for example, it is here somewhere. Here it is 4 centimeter, 5 or 6. So you have to see the 6 and then you have to do charting like X and then you have to join this. So this is a normal partograph. This is how you have to do. Okay. One more thing I want to tell you, dear. One thing what I want to tell you is that you can see these two lines. We are having an alert line and we are having an action line. Okay, what is the significance of using these two lines? Okay, let's see. So in the image regarding the PV dilation and all, always remember whenever the PV is done, one finger is equal to 1.25 approx. Okay, and 1.25. Now you can see, for example, in this image, we are having this alert line, we are having this action line. So can anyone have maybe you might be having idea why, what is their significance? The first thing we need to do the charting at the time of admission in the alert line, the second charting somewhere approx. But if a patient, for example, one patient came at this time, and after so much long, the patient's PV is somewhat 4 to 5 centimeters, so no dilation is there, for example. Now that patient has crossed the action line. So we need to do, see, in this thing, the patient is in kind of crossing the action line. That means some emergency has to be done. Some action has to be taken because it is a prolonged labor. It's a prolonged labor. It's a case of prolonged labor. So LSC is done in those cases. That's why what is exactly is Partograph? It is kind of graphical representation with the cervical dilatation, okay, and the fetal descent. Everything is a graphical representation there. That is a Partograph. So now you got an idea. So what is the significance between the alert line and the action line? If a client crosses the action line, that there is a need for emergency, means LSCS has to be, means the patient is crossing the action line. Okay, that means there is a need for the LSCS. Now, I think so you people are clear. Okay, let's move further. Okay, so talking, since for example, dear, let's have a discussion one by one regarding the each section and all. See, the normal FHR of a baby is around 120, is around 120 to 160. Is that clear? And if I tell you the like for example, the small boxes are representing the half hour. One small box represents the half hour. So if a baby is having FHR 120, you have to do in the next half an hour, the FHR was 130. Like similarly, you have to make it like dots, dots, dots like this. Okay, like that dots should be there. Sorry, dot is here. Then in the end, you have to join this line. Okay, you have to join this line. This is how the charting. Okay, let's move further. So you should not do any error while charting. Now, already in the first scenario, I told you about that key. We need, there is one more, two boxes are there. So if a baby is having, like for example, if a patient is having clear amniotic fluid, you have to write the C. If the membranes are like for example is rupture and you can see a meconium stain like then you have to write it as M. So what is the color of amniotic fluid? Dear, is kind of clear and straw color. Is it clear? It's look like very clear and straw color. Okay. And if a patient, if a mother, baby has passed meconium and all, it will look green in color. Okay. And you should know the various color compositions of amniotic fluid, which can be asked in NORCET exam also. Okay. And if it is some kind of yellow color, that shows the RH incompatibility. Okay, and it is very dark in color, that means a coffee color you can say means the baby is of IOD. Okay, IOD and all, like the client comes to the clinic area and they will tell, I'm not able to feel the baby movement from the last 2 or 3 days and the patient might be in the last trimester. Okay, and the mother may have IUD, intrauterine that fetus. So in that case, the amniotic fluid will be very dark in color. Okay, so let's move further. I already explained you about the molding. Molding is represented by plus, plus, plus one, plus two. If there's no molding, you can write it negative. Let's talk about cervical dilatation. I already told you whenever the patient comes, the first charting has to be done on alert line. Okay, it has to be done on alert line. For example, in this image, I will explain you. For example, the patient, patient came at 5 a.m. I'm writing the 5 a.m. over here. And when the PV was done, the patient's cervical dilatation was 6 centimeter. I already told you the first has to be done, has to be marked on this thing. Okay. Now, after maybe she might be multi-pair or something, and after 2 hours, like for example, 7 p.m., sorry, 7 a.m., we are talking about the a.m., the cervical dilation was like fully dilated. For example, she might be multiple. So you will gonna see fully dilatation means 10 centimeter. So you will see the 7 and you will go up in the 7 line and then you will do a X. And then you will gonna join these two lines. So this is how the charting for the Partograph is done. Is it clear? Okay. And the descent of the fetal head. Let's have a discussion regarding the fetal descent. Okay. Let's see. The fetal descent here is either we can do with the PV or it is done with the abdominal method and all. Okay. So let's see. So it is considered as with the per abdomen method 5 by 5 if you're able to feel the fetal head. Okay, with your whole finger 5, then 5 by 5, 4 by 5. Just imagine if a baby 0 by 5, that represents that baby is completely inside the pelvic brain. So per abdomen, we're not gonna feel the fetal head. So it is kind of practical. Okay, like hypothesis, kind of you can understand. Let's move to the uterine contraction. If you talk about the uterine contraction here, so how we will gonna find the uterine contraction? Where we will gonna find the uterine contraction? So let's have a discussion. Okay. So, for example, first of all, you should have a knowledge about the classifications of uterine contraction. So, I will tell you, for example, I'm standing over here. I'm standing over here, and the patient is lying like this. Okay, so I will be keeping my hand at the fundus for at least for 10 minutes. For 10 minutes, in that 10 minutes, I need to see about the number of contractions the patient is having. कितनी बार contractions आ रहा है and the duration. For example, right now the patient is having a contraction. Right now, I ask the patient whether you're having a contraction. The patient says yes, and I'm started with the pain. So I will check, I will see my watch and see the duration. So in the 10 minutes, the number of contractions, for example, whether 2 or 3 or 4 contractions were there, and which kind of quality of contractions was there. Okay. For example, one first contraction which lasted around 20, for example, 35 seconds. So I will be thinking, okay, the patient is having kind of mild, sorry, moderate contractions. So I will be marking it with X, like, sorry, like this line. Similarly, you should understand doing dot, 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 that means mild contraction. It is less than 20. Okay. And if that value is between 20 to 40 seconds, it is kind of moderate contractions. Okay. And if that contraction lasts for more than 45 seconds or 40, you can say it as a severe. So, okay, now I will explain you with an image. Let's move further. Okay, let's move further. I will show you image how to do a charting, and we are about to complete the Partograph session. Okay. Hmm. So if you're clear till now, let's move forward. So mild, moderate, and severe contractions are there. So for example, in this image, I was checking the patient's contraction and I got to know that patient is having moderate contractions of 3 contractions are there. So how I will gonna do a charting. For example, this was about 5 a.m., which is, this is only the contraction chart. And this is about 5 a.m. So in minutes, the patient might be having 2 moderate contractions. So I will be doing like this. I will do like this. I will do the shade. Okay. For at least 2 boxes. Okay, so that shows the patient was having how many? This is the contraction. y-axis, one contraction, two contraction. So I'm choosing the two box. Okay, and this represent moderate contraction. Okay. So for example, I just checked the patient contraction level and it was of severe, like more than 45 seconds and all. So that means I will, and it was 3. So I will be coloring this next boxes with full of color, dear. Okay, she was having severe contractions of 3, lasting for around like 40 to 45 contractions. So I will do it full color. Is that clear? So this is how somewhat the contractions are charted on graphical representation on the Partograph. Is that clear? Okay, let's move further. Okay, till now we are done with the FH chart, then with the molding, done with the meconium stain lacquer, about the amniotic fluid charting, about the fetal descent and the cervical dilation and the contractions. So this is image. Now you should not do any wrong. Okay, now you can see how beautifully there's the dot. That means it's of mild contraction. If there's a sketch line, is there moderate? Okay, and severe is colorfully. Now the next column below the graph represents about the oxytocin. I already told you oxytocin is given for the augmentation to increase the contraction frequency and all. Okay, so here you need to write about the drops, whether oxytocin of 2 international unit, how many drops, like for example, this has to be done there. Okay, so you have to write it 4 drops oxytocin at the rate at the rate 4 drops per minute, 2 international unit, like this, 2 international unit of oxytocin at the rate 4 drops per minute. Okay, I just erase this. So like that you have to mention over here, like 2 drops and 2 international unit over here. Is that clear? You should not do any blunder in this area. So how you will gonna do? Let's see. This is kind of 2 drops of sorry, this is for example 4 drops to international to IU. You have to write. You have to write the sign. For example, after some time, doctor said ki add 5 international. The 5 international unit, maybe it may be of 10 drops, like that 10 you write. So now you are clear. You should not do any mistake in this. Okay. Okay. Now, so this was already I told you about the drug or medication. If a patient is getting, you have to write in this column. The last is about the menses, about the mother's area, and you need to do the charting. For example, in this chart, for example, always remember, whichever the time you're choosing in the same line, you have to do all the charting. You have to check the mother's parameter. You have to check the baby's parameter. You need to check the fetal membrane descent, everything. You should not do any charting other than that. Okay. So now in the same line, for example, you have to check the BP. So BP, how you represent? The mother might be having 110. Okay. 110, you have to relocate. For example, this was 5 a.m., 110. By maybe 150, she might be having BP. So I have to do like this. This is how you have to do the BP charting. For example, at the same time, the mother was having BP around 70, so I have to make it by dot. Is that clear? The pulse has to be represented by dot, and whereas this arrow represent the patient's BP. Similarly, in the same line, you need to chart about the temperature. We don't want the patient to have a fever, but maybe some because of any kind of pyrexia, or mother might be having pyrexia fever, so we need to do charting. Okay, so if there's increase in temperature, it represents my mother might be having fever, be having infection. Okay, so now you're clear with this. Let's move further. Is it clear? Okay, so let's move further, dear. So let's move further. This is exercise also. Okay, this is the last about the urine. So urine, see the urine, I already told you, you have to chart about the urine presence of protein. See, if I talk about the protein test, even we as a human we will get a positive protein, in sense trace protein might be there. But if the protein level is +1, which is showing with the urine dipstick test +1 or double plus, okay, so that shows the mother might be having this eclampsia or preeclampsia, we can say. Okay, eclampsia might be there. Okay, so you have to write acetone, and then you have to write the volume. Maybe mother has like passed 30 ml, I know. So So now this was a complete representation I have taught you. So if you think you have you got an idea how to chart a partograph, please don't forget to like my video. Thank you so much, dear. Very happy. Okay, thank you so much.